My name is Justin Brophy, and this is a presentation on syphilis. So, syphilis uh, is a sexually transmitted disease caused by the bacteria Treponema pallidum, which is a gram-negative spirochete. While it's gram-negative, it actually, in some respects, behaves like a gram-positive, and that'll be important for the treatment of this. Now, I've included here a microscope image of the bacteria, as well as an image of Al Capone, because he was one of the most infamous people to have syphilis. Now, before we get going into this, because it is an STI, there are some diagrams that might be a bit offensive to some people. There's a little warning before them, but that's the nature of talking about STI. So transmission reservoirs, transmission of this bacteria and therefore syphilis really only occurs through direct contact with with someone else, usually bodily fluids, and this is associated with sexual activity. And usually what happens is you come in contact with an infected sore, and if you have some sort of abrasion or cut or exposed mucous membrane, the bacteria can move from that sore into your body and then infect you with syphilis. Although that is not the only way. It has also been shown just through, for instance, fluid sharing, like kissing, things like that. Humans are the only reservoir for this bacteria, so you cannot get syphilis from animals or from any sort of inanimate object. You need to actually have contact with another human. So here's some incidence and prevalence, and these numbers are usually estimated, and it's a bit tricky because some of them are more updated than others, but I'm just going to give a broad overview. So as of 2012, the World Health Organization estimates around 5.6 million new cases of syphilis each year between the ages of 15 and 49. The reason it's the ages of 15 and 49, that's really the ages where we see syphilis. So outside of that isn't really important, and it just kind of throws off estimations. That comes out to around 150 people per 100,000, I believe. And then in the United States, the CDC actually has pretty good data collected, and they estimate about 11.9 cases per 100,000 in the United States, with a total of about 40,000, and that's, I believe, per year. So the 1 and 2 there, that's primary and secondary. They're only counting here primary syphilis and secondary syphilis, which we'll get into a bit later. And then syphilis has been on the rise lately in the past decade, both primary and secondary syphilis, as well as this third category, which is congenital. And congenital syphilis is when essentially a pregnant mother has syphilis and they then pass that on to their child, either before birth because the bacterium can actually pass over the placenta, so you can actually pass from mother to child, or it can happen, it's much more rare, but it can happen at birth, just because as you're moving through the birth canal, it's the same way like that sexual contact, and those are congenital cases. CDC estimates almost 1 million maternal cases, and that's worldwide, so I think they're actually pulling data from World Health Organization there. But anyway, that's 2012, and of those almost 1 million cases of maternal syphilis, they're seeing about 350,000 cases of congenital syphilis. And of those 350,000, about 200,000 result in death, 143 from early fetal deaths and stillbirths, and then about 62,000 from neonatal deaths, so that's right after birth, or just before, anywhere kind of after that time frame, I think even up to a year. And then the remaining about 150,000 incidences of congenital syphilis resulted in around 44,000 preterm or low weight births, and just over 100,000 infants affected. And so this can happen. Congenital cases can be anywhere from asymptomatic to causing a premature birth, which comes with its own complications, but may or may not be fatal or have a lot of long-term damaging effects. But it can all absolutely, and it absolutely does, cause a lot of infant death. So congenital cases, big deal, big reason that syphilis is actually so deadly. So now we're going to get into the types of syphilis. So we're going to see some diagrams with genitals involved. So you've been warned. Type 1, there's three basically progressions of syphilis: primary, secondary, tertiary, and they each have their own kind of symptoms. So primary starts with canker. So those are the little sores basically, and they're actually a lot of times painless, and so it actually people that have them won't know that they have them, but they usually develop on the site of contact. So here we see genitals and we see mouth, anywhere where you're actually getting infected, and those appear roughly 3 weeks after exposure. Then if untreated, you can progress to secondary syphilis. So secondary syphilis is going to have a rash. The image on the far left is somebody's back, and that's usually where the rash begins, is on the trunk, and then it can move to the extremities, so legs and the hands. And you also see occasionally hair loss, muscle aches, sore throat, and swollen lymph nodes. But the big thing is that rash and the spread of that rash around 3 to 6 weeks. And then I don't know if I'm blocking it here. Let me move my camera real quick. If this is left untreated as well, you can actually progress to latent stage, which is where you essentially become asymptomatic, but you still have syphilis and it's just dormant, and that can last anywhere from years to an entire lifetime. So then you get the tertiary or late stage. So tertiary or late stage is essentially when a latent infection reemerges, and it reemerges in a very damaging form. So it's only about 15 to 30% of untreated syphilis cases actually get to this stage, but if they do, this is where you get a lot of damage. It can affect your brain, your liver, your bones, your heart, and very specifically your brain and your heart, as well as a few things with your bones. But the brain, the most common usually is neurosyphilis, and that's what someone like Al Capone would have had. And that can cause, the swelling can cause meningitis, which can lead to death. It can cause or lead to simply having cavities forming inside your skull. I forget the name of them now, but it's all bad. You don't want to have this type of syphilis, so you really need to treat it before you get to this. So then we get to treatment, prevention and treatment. So the preventative methods used for this disease are abstinence, monogamy, and any sort of barrier protection. So abstinence, obviously, you're not going to come in contact with someone and in a way that you could actually contract the disease if you're abstaining. Monogamy, if you guys, if there's two people in a relationship and they are both clean, you're not going to get it from somebody that doesn't have the disease. And then barrier protection, this is condoms, dental dams, and the like, physically blocking that movement of the bacteria from one individual to another. As for treatment, treatment is pretty simple as long as the disease is caught early. So if it is, a single dose of benzathine penicillin G, usually injected, will treat primary, secondary, and early latent syphilis. So if you happen to have that, you just go and you get a shot of penicillin, you're good to go. And then usually it's recommended to do 3 doses spaced out over the course of 3 weeks if you actually have a latent infection. Now, the biggest issue obviously for something like syphilis is not knowing that you have it, and then as well as back to congenital, because that just causes death before you can really treat it. But generally speaking, it's pretty preventable, pretty treatable. So that's been my presentation. These are my image sources. Thank you for watching.